Welcome, everyone. We're so honored you've decided to join us during your lunch hour. Thank you so much, and welcome to our monthly Bear Update. This month, we are tackling telehealth and how it has become an essential tool, plus a update from our Diamond Society specialist, Annia Martinez, who many of you know very, very well. So welcome. We're so glad you've joined us. My name is Michelle Boggs. I'm president of Nicklaus Children's Hospital Foundation, if we have not yet met. And we just wanted to genuinely thank our Diamond Society donors. You all are truly so generous, and your support of our hospital really makes it possible for us to do what we do every single day. So thank you so much for your support. And before we kick off our program, I did want to remind everybody about our upcoming Diamond Ball. It's our 14th annual event, and we've had to go virtual, but we're very excited. It's Diamond Ball, an auction benefiting Nicklaus Children's Hospital, and it's taking place on Thursday, December 3rd at 7 p.m. So I hope you can join us. It's free and open to everyone. We will send out details at the end of this webinar. So I get the pleasure of welcoming and introducing our very special guest this afternoon, who are going to talk to us about telehealth. So first, please join me in a warm welcome for Dr. Saima Aftab. Dr. Aftab is a neonatologist and the Nicklaus Children's Pediatric Specialist Chief of the Section of Neonatology. She also serves as a Vice President for Organizational Initiatives for Nicklaus Children's Health System. In this role, Dr. Aftab is vital to the planning and development of programs aligned to the strategic and tactical vision for our hospital. She leads business development initiatives, identifies new growth areas, and assesses strategic partnerships and market opportunities to move our organization forward. In addition to all of that, Dr. Aftab provides leadership to the hospital's global health initiative, Nicklaus Children's Pediatric Virtual Care Telehealth Service, and the Physician Liaison Team. Welcome, Dr. Aftab.
Thank you very much, Michelle, for that introduction.
And our other very special guest is Evelyn Terrell. Evelyn is the Director of Telehealth and Special Projects at our hospital. She has extensive operations experience leading multiple service lines and programs. During her tenure with us, she has served in various roles, including Regional Director of Rehabilitation Services, Director of Global Health and Orthopedic Surgery. Evelyn holds a Master of Science in Health Services Administration and a doctorate in Occupational Therapy. She is an adjunct professor at NOVA and a chair of the American Telemedicine Association Special Interest Group. Evelyn is a thought leader and regular speaker at national conferences, where she often lectures in expertise in telehealth, including best practices, outcomes, and opportunities in pediatric virtual care. Wow, ladies. Thanks, Evelyn, for being here.
Thank you so much for the introduction. Very happy to be here.
So Evelyn and Dr. Aftab are going to kind of give us a quick overview of telehealth. As you know, it has become very much a new normal for us as we navigate through COVID. And after that, we will open up our Q&A section. So please feel free in the chat to type any pressing, burning questions you may have, and I will do my best to get to all of those questions. So ladies, I will let you take it from here.
So I'll get us started. Thank you again for having me, having us. It's a pleasure to be here, and happy to tell you a little bit about our telehealth journey. And it's been quite a ride. It's been wonderful. We were a believer of telehealth and invested in the technologies and the infrastructure in creating a telehealth program. Many years ago, we opened our telehealth center back in 2013. And it was several years of a lot of accomplishments and great outcomes to showcase, but also some challenges. And from a legislative perspective, from a reimbursement perspective, it definitely was a challenge to create that adoption because many of our patients did not have the coverage to receive the services and the care. So back in March, when we all went through so many life changes, we had to very rapidly scale services across our organization, across all of our other outpatient center services, providers. And it was really about continuing services for our patients with the shutdown and being able to make sure that we didn't impact their healthcare, their wellness through not being able to access healthcare services. And so although we had a telehealth program for many years, many of our providers had not delivered services. Our patients hadn't experienced the care. And so we had to very quickly train our providers. We trained over 300 providers during this period. We had to train our patients as well and orienting them on how to download the application to receive care. We had to make enhancements to our platform to support that. And it was a few days and weeks of this massive endeavor, and work that we had to, a lot of heavy lifting. And so we did it in a very few days. And for some of our providers, from the moment that we decided to have telehealth across the organization, they were able to launch and see their first patient within a few days. It was really remarkable. Although we had this passion for telehealth, not everybody really saw the value, right? We hadn't experienced it. Our providers hadn't delivered it. They hadn't really kind of opened their eyes to the possibilities. And it's really about traditional care, the way that our providers were trained to deliver care and to feel and to be able to palpate. And so, but of course, the value was, endless in terms of being able to continue services. And that was really the only option for those during that period of time. So we rapidly scaled. We had over 300 providers in over 24 specialties deliver services to our patients. And we've now delivered almost 30,000 visits in all of the different areas. Of course, we have some of our specialties that lend themselves more. We're able to see more patients via telehealth. So naturally, the psychiatry department, we have over 35% of our visits are mental health related, and also about 37% of those visits are subspecialty services. We do have our top three, and so for our subspecialty services, gastroenterology, endocrinology are among our top providers. And again, it's about, the telehealth is not appropriate. It's not a kind of appropriate for across the house for all services. We can do a lot via telehealth, and we've learned that there is a lot of services that can be delivered virtually. And now that we know, it's definitely part of the future of healthcare. Other outcomes that I can talk about is we've had such great patient satisfaction. We've been collecting surveys from patients for many years, but now that we have such a large volume of patients being seen virtually, we've been able to get more data, right? That's statistically significant, that is useful and meaningful. And we are way above the 90th percentile when we look and we compare ourselves across other we benchmark across nationally across other organizations. And also when we compare services, so the same questions that are asked of patients when a survey is submitted and administered, when we compare similar questions to traditional visit in person to a virtual visit, across the board, all of the services or the responses for virtual visits are higher. So our patients report higher satisfaction when that service is delivered virtually compared to in person. And after the very rapid implementation and all of these great outcomes that we've seen, we've really now transitioned to looking at process improvement. How can we continue to expand our services? How can we create more inclusionary, exclusionary guidelines to really determine what are the most appropriate encounters, what are the most meaningful to patients, and most value added to our patients and as well as our providers. And looking at how can we really embed this in the way that we deliver care. Many of our providers are now delivering a hybrid approach to care, where some of our areas like psychology, we're seeing 100% of their patients virtually in the middle of the pandemic. They were able to convert all of those outpatient in-person visits to virtual. Now they're moving to the future state is it can be maybe a 40-60 combination or percentage wise, virtual to in-person. So it's really amazing now that all of us really see the value, and it doesn't come with challenges. Sometimes there can be technical challenges, connectivity challenges, just like many of us have, I'm sure, experienced with just, meetings, virtual meetings and such. But we've done a lot with process improvement. So providing tools for our patients, we've implemented, for example, customer support lines, troubleshooting lines, as well as information lines, providing patients information on COVID, testing, where can they get screened. We've also expanded our direct-to-consumer platform, and that is still was live before the pandemic, but we've expanded our office, our hours of operation. And we also are providing for limited time a Kids 19 code, which provides free virtual visits for the community for COVID related concerns. So that is, in a nutshell, a little bit about our journey the past few months, and I'm happy to take questions.
I'm just going to add a little bit on to what Evelyn said. Again, thanking you all for your support for Nicklaus Children's, and as pillars of the community for the past 70 years. I know you and your families have been huge supporters for both telemedicine and all the other innovative programs that live at Nicklaus Children's. You also recognize that Nicklaus Children's is a medical home for a lot of chronic complex patients. And the one thing that I personally learned was that there's a lot of barriers to accessing care for a lot of our families. Traveling long distances, especially with a special needs child, creates a huge barrier. And telemedicine, while it's not the panacea, I don't think it's going to ever completely replace, a visit with your doctor and be able to do all the things we need to do. But for certain populations, whether it's mental health specialties where you need the privacy, comfort, the security of your own home environment, having very sensitive conversations, or for parents of chronic complex kids where taking a whole day off from work to bring them in for one appointment, with a child that's in a wheelchair or has special needs or is high risk for infection, I think telemedicine has been a game changer. So we're very proud of our program. We've had a 9,000% increase in our volume, and the quality so far has been fantastic. And we're learning a lot as we go with this. So we thank you for your support, and we're very eager to get questions.
That's great. Before we do that, just again, wanted to thank you both for staying the course and sharing some of those incredible highlights with us. A now 9,000% increase in care, 30,000 plus visits, being able to meet folks where they are and provide 24 different specialists is amazing. So thank you guys for staying the course through what was that crazy couple of months to get us going and able to help the community. So thank you both so much. All right, so let me take a look at some questions here in our chat box. All right. So the first, does insurance work the same way with a telehealth visit compared to an in-person appointment?
So I'll take this question. Yes, it does. So we've had so many flexibilities, and during this pandemic, due to the public health emergency, where most all payers that we are contracted with are providing the reimbursement for the services. It was really a 100% switch from having a very few payers that were approving and authorizing those services before the pandemic. And it's really facilitated access, as I mentioned. Having that reimbursement is so key. We have the insurance, we created a matrix where we looked at the payers that were authorizing the services, and again, across the board. And so we hope that is here to stay, definitely looking out for what happens after the public health emergency ends.
Evelyn, how about copays and deductibles?
So it really worked the same as an in-person visit. Right now, all services are being reimbursed the same as an in-person visit. I am curious to see what happens about in the future, because we do know that for some payers, they may reimburse the provider less. There's some payers that have really advocated for not having parity or creating parity laws, which basically are not having that and meaning that the telehealth visit potentially could be reimbursed at a lower rate, but that's not the case right now. All the co-payments, the co-insurance, everything is the same.
Okay. How does our telehealth program take payment? Do you have to pay ahead of time, or do you receive a bill after?
So the majority of our practices do collect the copay or the co-insurance prior to the visit. In the case of the virtual, workflow, sometimes the patient pays right before the virtual visit or right after the virtual visit. But again, most of that co-insurance, co-payment happens the same day of the visit.
Okay. If insurance doesn't approve a telehealth visit, what is the patient responsibility?
So right now, again, we're very lucky that we really haven't had that happen. In the future, or when there isn't reimbursement, of course, the patient has the option to pay out of pocket, or also if in the future the virtual visit was not authorized, really educating them on what are the possibilities other than, in an in-person visit. Of course, they can come in for our practices to be seen in person. We do have some services that we anticipate will not be reimbursed in the future, even if there's reimbursement across the house, so across the board. So, an example is for our psychology team, we're in the process of implementing an exciting pilot program, which is looking at mental wellness and is really about prevention. We do know that there is, besides the pandemic, we have a crisis, a mental health crisis that has been present before the pandemic and has been so much, accelerated because of the changes and everything that we're dealing with. And so one of the options will be for this program, which would be grant funded, is creating that mental wellness visit, which many payers do not reimburse in current state, whether it's an in-person or a virtual visit. So we're looking at options, other options for funding some of our services that are not reimbursable by the payers.
Okay. Do we need any special equipment for a virtual visit?
So most of our visits, all of our visits really during the pandemic have been virtual visits, audio visual, just like we're connecting right now. And it's almost all patients have a device, they have a mobile device, an iPhone or an Android, and a very large percentage of our patients are connecting with their phone. So we do, and most of them are connecting with their iPhone or a tablet. And so because many of our patients, our families do have a device, it's really hasn't been as much of an issue as maybe we thought initially. And really the significant point is to have a strong Wi-Fi connection, which can be a challenge sometimes. Some areas that perhaps are a little choppy and patients could get dropped. We very much look at data. So we have analytics and metrics that we track, and that is one of the metrics that we track. So drop calls, the quality of the call, and of course we have the patient satisfaction surveys also, where we're obtaining information from our consumers that way.
Evelyn, speaking of preparing for the appointment, is there anything, special to take into consideration with kids to prepare them for the appointment? I mean, they're used to going to a physical doctor's office. Is there anything we can do to, best prepare our kids if they're going to have a telehealth appointment?
So that's a great question. And, because of our children are so much, techie, and that's part of their world, it's oftentimes that the patients and the children are helping the parents establish a proper connection. And it's just wonderful to see. They embrace it. It's part of their world. So it really hasn't been as much of a challenge. Definitely some families we do see are less comfortable with technology, although they all have a PC or a tablet or a phone to connect, a mobile device. They may not be as comfortable with the technology. And so we're actually studying some of the data, and it shows that more patients or less patients that have Medicaid insurance are connecting virtually as compared to in-person visit. And it's interesting data to look at, to potentially do research on. And what we're finding is, or what we think we'll find, is not so much the technology having the device, but having the comfort, with the technology. But some of the areas require more setup or preparing than others. So if a psychologist is going to see a patient, or a rehabilitation service provider is going to do a virtual visit, the patients and the families may require certain tools or equipment that they need during the visit. So there's a lot of communication, really preparing for that visit. If they need a certain equipment or anything that they need in the home to conduct that visit or participate in that visit, we want to send them an email. We want to communicate what kinds of tools. So it's really interesting. Some of our providers, for example, have asked the patients to create a box. It's a therapy box, for example, having all of the tools that they may need during the session. But for our physicians and our subspecialties, really, it's more about the preparation for the connection to make sure that we are establishing a good connection really for all of our services, not as much planning in that instance.
Is there any kind of testing folks can do before their appointment to make sure they have, the correct strength of Wi-Fi?
So yes, we send them.
Like, is a FaceTime call sufficient enough to practice with a friend or family member?
Absolutely, and it's really about the connection. So once they download the app, making sure that they have their microphone and their video, and we have been trying to anticipate some of those issues. So we send a text, so we implemented SMS text where the patient receives a link, and that link will direct them to our app. It'll also direct them to certain resources. It has our phone number. The telehealth center is 8 hours a day. During business hours, we're open. I was going to say 24/7, but not quite. During all of our office hours where we're providing services, a patient can contact the telehealth center and be connected to one of our agents within a few seconds, sorry. So we actually track the call center analytics, and we are answering the phone call within 30 seconds, 99% of the time. So if they do have a challenge, we can troubleshoot with them at that moment.
And Michelle, one thing that was very important to us was, as we were transitioning to telehealth, we didn't want to miss the patient experience. We didn't want to lose the intimacy, the sort of caring, the compassion, the thoughtfulness that came with connecting with your provider in person. So we didn't want to miss that. So we have incorporated in our training different simulations that our providers go through to make sure that they're not only comfortable, but they're actually well prepared to have those conversations and be able to talk to a child in the room and make sure that they're explaining why they're asking questions, or if they want to see different parts of the body to do a physical exam through the camera. So we set that up. But the other interesting thing is, the one thing we didn't recognize was, in some places, telemedicine's actually really helped us beyond an in-person visit, because we've been able to do an in-home assessment for, safe sleep, for example, where physicians can actually look at the room, the bedroom, and see, how, the baby's crib is set up, or, looking at what medications are they taking at home. And moms sometimes describe that my child is on such and such medication, or I'm giving my child this vitamin supplement, but they're able to hold up those bottles and show it to them and demonstrate how much they're giving or how they're dispensing it. So there's little things that we didn't recognize that telemedicine could really in the home provide that support that sometimes is a miss when you're seeing someone in the office.
So true. That's so great. When we make a telehealth appointment, can we expect to see NCH doctors, or do we outsource them?
So all of the services that we provided during the pandemic, I mean all the Nicklaus Children's Health System providers have been delivering those services. We also have private practices, so private practices that are based here at Nicklaus that are also providing care, and they're using their own platform, but they're also delivering services virtually. We have not outsourced. That's definitely an option if there is a critical shortage area or a specialty area that we could not provide. We could definitely have that option. There are companies out there that are willing to partner with us, but for all of this time, we've had all of our providers employed by Nicklaus Children's.
And to your point, every single provider that you'll connect to through the NCHS Anywhere app will be credentialed and trained on our platform and would have completed the requisite courses to make sure that they are not only prepared, but meet the standard that we set for Nicklaus Children's for virtual visits.
Great. Someone in the chat, Evelyn, wants to know, you alluded to some services not being able to be offered through telehealth. Can you elaborate a bit more on those?
So I'm referring to services that are typically not reimbursed by insurance, because right now the insurances are providing the same level of reimbursement as an in-person visit. So those are, the example I gave was mental wellness. So wellness visits that would be delivered by a psychologist are not typically reimbursed by insurance. And what that means is that a child exhibits issues, whether it's anxiety or mental health concerns and they do not have a diagnosis. They haven't been diagnosed with depression or other mental health illness. And so oftentimes insurance companies will not reimburse for that services. And what a mental wellness visit can look like is that a provider, a pediatrician, identifies a concern or an issue and perhaps can collaborate with a psychologist, be connected to a psychologist and discuss the concern and provide guidance to that family very early on, even before that diagnosis is given. And what that does is that it creates such a critical service at a very critical time, really before that, when that patient starts to exhibit those issues and potentially prevent a crisis from happening or escalating.
Yeah. Thank you. Do you see telehealth being the future of what were typical physical office visits? And are these telehealth visits as effective as an in-person visit?
So, there's so many endless opportunities and possibilities. I've heard it be called the modern day house call, from many decades ago, where we had our physicians going into the home, and we know that is an option that's available, but too few in today's healthcare system. And so there's endless opportunities. It's not about the future, it's about our current state being that telehealth is going to have a critical role in the healthcare delivery system. As I mentioned, with the hybrid model of in-person and virtual, that's definitely, I see that as part of the future. Some areas, some specialties more than others, as I had mentioned also earlier.
It's interesting. I think there is just in this recent national state of emergency, there has been widespread adoption of telemedicine services, and I think we just don't know enough yet. As more and more information comes in, we'll recognize that there's going to be certain conditions, certain specialties where telemedicine may be superior to an in-person visit, and I can think of mental health services in that realm. But in others, it may not be a perfect fit to that. I do think, and I say that partially for job security, that physicians will always need to see their patients in person, because there's some components of the physical exam, seeing a patient in person and being able to assess them, I think will continue, but I think it would look a little bit different. Already there's a lot of practices that have had a hybrid approach to a well-child exam, where they do a lot of that in-person intake, the questions that you need to ask, how are you doing in school, what your eating habits are, all the detailed history can be accomplished virtually. And then the component that needs to happen in the office is very much a quick, fast pass sort of a system, where you go in, you quickly get checked, you get your shots, and you go out. So there is a lot of efficiency to be added by including telemedicine, especially in a time when we're trying to social distance. But what the future is going to look like, my guess is it's going to be, again, a hybrid type of an approach, where there may be, it may be the norm that some portion of our visit, the long waiting that we do in a doctor's office, and the waiting room will go away, and most of your intake, all those questions that need to be asked, it can be done ahead of time, and you get to meet your doctor virtually before you go into the office. And you really have that connection where you don't feel rushed, because the physician doesn't have to move from room to room to room. But then when you go in for your blood work, for your physical exam, and for more follow-up care. So it'll be interesting to see how it shapes up.
This thing I would add is that I mentioned earlier about having inclusionary, exclusionary guidelines. We've had those before the pandemic, where we had very specific services that we were able to deliver virtually. And now that we've expanded across so many areas, we're going to have those guidelines still, but many times the provider is making that decision. They know the patient, they know what's appropriate. And in some instances, we would think, for example, a child had a surgical procedure and the physician needs to see the wound. And oftentimes that patient is coming in person, but if the child has, they're significantly a distance away from the hospital and they need to do a quick check, that can happen as well. So there's going to be a lot of decision making from the provider who knows their patient, who knows what can or cannot be done virtually. And we will continue to make those decisions together with the practices.
All right, ladies, let me check our chat box. It looks like we have one last question. How do we schedule a visit?
So the visit is scheduled just like an in-person visit. They can call the practice, they can call our scheduling appointment line as well and schedule that virtual visit. The practices have instructions, they provide patients with the instructions in terms of what is different. And it's really not a lot of differences other than having to download the application and having to connect virtually. The process is we've tried to make the process as seamless and as easy as possible for patients. So it's not very much of a deviation from what they experience for in-person visits.
Great. Well, I learned a lot today, you guys. Thank you both so much. I hope everyone who was able to join our webinar also learned a lot about telehealth. We're really proud of our program, and thank you both very much for being with us this afternoon. As far as making a visit, this is a perfect segue because you can also call Annia. She'd be more than happy to help you set up your telehealth visit. Annia, who you all probably know very well. There she is. Hi, Annia.
Hi, everyone. Thank you, Michelle. So as you all know, the Diamond Society is a concierge thank you benefit to our donors, which allows me to expedite emergency visits or any appointments in a timely manner. And through telehealth, while navigating through COVID, it's just been great. Within, I think, the first or second week, I was able to make appointments. We're still expediting the visits. It's been a great tool. We had a lot of families that went out of state through COVID, and they were able to do the visits through telehealth, and it was really amazing. I think I've scheduled from ortho to gastro to neurology, just pretty much all of our practices have offered the services. And it's just a quick call. I set up the virtual appointment, and that's it.
Great. Annia, in general, can you give the group just an update on the concierge benefits and what's available to them as Diamond Society members? And if you want to share any, best practices for appointments or emergencies, just a refresher might be great for the group.
So the Diamond, as far as the levels, Diamond Society, it's a benefit program for donors that give $50,000 and above. And that's a concierge service, which is 24 hours, 24/7. And I am available at all times. The emergency visits are pretty much any emergency visits are made, I make the call to the emergency department, and we tend to expedite all the visits and without delays. Same with appointments. All of our appointments are, I have a great relationship with the office managers or office staff, and we're able to get them in as soon as possible versus 6 months or 3 months. I could get them in sometimes even the same week.
Great. So Annia's here for whatever you all need, and a big thank you to Evelyn and Dr. Aftab. We really appreciate you guys joining us. A reminder again about our Diamond Ball coming up on Thursday, December 3rd. We certainly hope you can join us that evening. Wishing you all a great rest of your day and a wonderful holiday season. Thank you and take care.
Thank you.